Hey everybody, I'm your host, Dr. Bob Lee from 107.5 WBLS, and you're watching Open. It's that live interactive program that brings the Bronx and New York City straight to your TV set. You can stay connected to us on social media at BronxNet TV. Now, leading things off, we're joined by a gastroenterologist and internal medicine specialist. She's with us to speak about the importance of the digestive system on the Black and brown community. Check out the health. We're going to be talking about that. Also to raise awareness on colorectal cancer. So please welcome to the show, Dr. Cynthia Quainoo. Dr. Cynthia, welcome.
Hi, thank you. Good morning.
Doctor, tell us a little bit about yourself. I know we've been on many times before. In fact, the last time we were on, I think we were on with about two other doctors, and we spoke about a number of things, but I know you're still doing some of the same, and you're creating the awareness that it is so very, very important to get that screening, get that checkup to find out what's going on with your body. Can you tell us, our audience, a little bit about yourself and how you got into gastroenterology?
Sure. So I'm Dr. Cynthia Quainoo. I am a gastroenterologist in Brooklyn. So gastroenterology is the diagnosis and management of digestive diseases. So that includes everything from your esophagus to your anus and everything in between, pancreas, liver as well. My interest in gastroenterology started when I was a resident in Newark, Rutgers University, treating liver patients, basically. And that's how I ended up in GI.
Yeah. From treating liver patients, how
Yes.
did you get into your gastroenterology? Because I tell you, I was sitting at a diner and there was a group of doctors. I didn't know they were doctors until I heard them speaking. You know, I was kind of nosy, I was eavesdropping. And my table was here. Their table was like maybe a couple of tables away. And one doctor laughed and said, well, had they only known, all they had to do is drink water and they wouldn't have to come and see us. How true is that?
Sometimes it's that simple.
Is it that simple?
Sometimes it is. Not all the time, but sometimes it's that simple. Sometimes it just comes down to good diet, exercise, and a good diet includes taking in enough water, taking enough fiber, fruits and vegetables, and less meat. Yeah. So sometimes it is that simple.
Whew. Yeah. Wow. I mean, that's simple, but, you know, of course you have to do those other things too. Can you tell us about the significance of the digestive system and the impact of poor diet and digestive health in the Black and brown community?
Sure. So some of the diseases that affect the GI tract that come from a poor lifestyle, poor eating, not only just affect Black and brown communities, but I think the prevalence is reflected in the statistics with obesity and diabetes and hypertension, right? So all of these things are interrelated, you know. So if you are obese, you have a higher risk of having, let's say, heartburn, for instance, which is reflux of your stomach contents into your esophagus. That can cause a lot of inflammation of the esophagus. Over time, inflammation in esophagus can cause ulcers, can cause strictures. And in a worst case scenario, it can put you at high risk for a condition called Barrett's esophagus, which over a long period of time can become esophageal cancer. And honestly, the complete kind of treatment for this is weight loss. Right? So sometimes it is as easy as what you eat and what you drink.
Yeah. Is there an association or correlation between COVID-19 and having problems with colorectal or your esophagus or your digestive system?
Sure, that's a great question. Actually, during the pandemic, we started to see a lot of patients with like an acute diarrheal disease or diarrhea, fevers, body aches, reflux even. And later on, we found out that these GI symptoms are prodromes to the actual COVID virus illness itself.
Wow.
So it always starts out with kind of GI symptoms and then it evolves to affect the rest of the body.
Yeah, wow. Why is it so important to continue raising awareness of colorectal disease?
because it's out of all the cancers, it's pretty treatable. It's preventable, number one, and absolutely treatable. And in terms of death statistics, Black men and women in this country kind of lead the pack. So it's improved, but there's still a lot of work to be done. Colon cancer and colon cancer screening is not very sexy to talk about. And so I think beginning with conversations like this to help kind of break down the stigma and help people converse about it a little bit more freely and more easily will improve awareness and allow people to talk about symptoms and family history and so forth.
Well, I'm so happy, and I'm glad that you're in the position that you're in, because you're able to help so many people and create that awareness. And I'm happy that we're helping you to do that too. What age groups and genders are most adversely impacted by colorectal cancer?
So men are slightly affected more than women, and the people over 60 are at risk. And so this is why we start our screening earlier, around the age of 45.
Yeah.
Now, if you have a family history of a first-degree relative who's had colon cancer, your screening should begin 10 years prior to the age of diagnosis of that family member.
Yeah.
Okay, so these risks need to be discussed with your doctor. You may be a candidate for someone to have a colonoscopy at an early age.
Yeah. What age should people, and how often should people get screened? And what are some of the signs and symptoms? Are there any signs and symptoms?
Sure. So the ages for, average risk people with no family history, the age is 45. How often you do the colonoscopy depends on the findings of the initial colonoscopy. If you have a normal colonoscopy, you can repeat your next colonoscopy within 7 to 10 years. If you have one polyp, that time frame gets shorter. If you have more than 3 polyps, it becomes even shorter. So it really depends on the findings. With regard to some of the signs and symptoms, I think along with myself, most gastroenterologists can tell you a story of someone who came with no symptoms for screening and was found to have a colon cancer. So be very aware of that. Just because you don't have symptoms doesn't mean that there may not be a problem. But once you do have symptoms, it's often a sign that it's a little bit more advanced.
Yeah. And you spoke of polyps. For those who don't know, what are polyps?
So polyps are just small abnormal growths of tissue. And there's different types of polyps, but to keep it simple, those polyps can grow and develop cancerous features. And the larger they are, and the more those cells change, the more you put yourself at risk for colon cancer. And so the idea of doing a screening colonoscopy is to go into the colon and remove those little growths when they're just small, very small. And that has been shown to decrease the risk of developing colon cancer over the long run.
Is there a way to dissolve them by diet?
So you can't dissolve them if they already exist, but you can overall decrease your risk for colon cancer by having a diet that's high in fiber, lots of fruits and vegetables, less meat, right? Exercise, and avoiding tobacco and alcohol as well.
Got it. All right. So you're doing your thing in it, Doctor. Thank you so much for sharing all this wonderful information. Do you have a website or somewhere where we can go to find out more about what you're doing and so we can follow you?
Sure. So you can email me at Cynthia Quainoo at nygidocs.com. My office number is 718-336-3900. I'm on Instagram as CQ Method, METHOD, and I'm on Facebook just as Cynthia Quainoo.
Cynthia, there is a big stigma about going in there and some people feel like they're being violated, but try to comfort us a little bit. What can we do?
So there is a lot of stigma about that, and really a medical exam should be removed from that kind of emasculation or idea of sexual impropriety. Those things are completely separate. And if you have concerns that are specifically have to do with that, you have to voice them so that your doctor can address it. But this is just a routine exam. It's about 12 to 15 minutes at most. You're completely asleep during the procedure. You will have no pain during the procedure or no awareness that even the procedure is being done. If you do have a history of sexual trauma, or if you have a history, or you just prefer to have the same sex practitioner, you can always request that as well. I've had women request that only women be in the operating room when they have their procedures done, and we're very easily able to accommodate people. So this is a very low risk exam, and it's often not what people think is going to happen. Most of the time, my patients wake up and they say, "Oh, wow, I didn't expect it to be that fast and easy." So,
yeah. Doctor, thank you so much. Dr. Cynthia Quainoo, MD, Gastroenterology, Internal Medicine Specialist. Thank you for sharing all of this wonderful information with us right here on BronxNet. We appreciate you.
Thank you for having me.
All right, we'll see you soon. All right, we'll
All
take
right.
a quick break right here. I've got more open, all coming your way. Kick off your shoes and relax your feet. Here we go now.